first thing I'm going to do when I, just like the other 7 ones I'm going to say.
BSI, scene safety.
BSI, scene safety, come up. What kind of questions can I ask her? Because I'm not going to come up, put this up, start putting pressure over the baby, right? So what kind of questions could I direct, lady?
How long are contractions?
Great. How long? Are you pregnant? She's going to say yes for testing purposes. And then, how long are your contractions?
How far apart are they?
How far apart are they? She's going to say anywhere between 2 to 3 minutes. And if I ask her how long are your contractions, she's going to say anywhere between 60 and 90 seconds. And then also another great question: do you have the urge to bear down? Do you guys see all these questions? And if she answers all those questions, if she says it's, her contractions are, 2.5 minutes apart with lasting anywhere between 60 and 90, and yes, I do have the urge to bear down, we're seeing what birth is what? Imminent.
Would you ask if her water froze? Would that be a good question to ask?
Yeah, you can ask that, and then also you can visualize it. So, and what's he talking about? The water? What's that? Sac called? Amniotic sac, right? It's a fluid that unit has been floating in for 9 months. Okay. And as it comes down that birth canal, and then during the stages of labor, it ruptures, and that's usually the first sign that labor's starting. So, but we're assuming that the amniotic sac broke. And then if, for example, that's a good question. If it didn't break, what could we do? What do we need to do? Puncture it, gloved hand, poke it. Good. All right. So those are great questions. You guys hear those questions? Say, well, are you pregnant? How far apart are your contractions? How long do they last? And do you have the urge to bear down? Some good questions. All right. She answers all those questions. Go ahead and tell the patient, I'm going to go ahead and make sure everything's okay. You're going to lift this up so you can visualize. And what do you see right here? Crowning. So this is all that information is now, birth is imminent, and we're going to go ahead and go into delivering this baby. So the very first thing, you're going to come up to your little baby kit, open it. So I have my gloves on. I'm going to take my sterile wipe, my pads. I'm going to wipe from anterior to posterior. And what I do, whatever I take out of here, I always put on this side. I'm not like going like this and then throwing it all over the place, going crazy, right? So try to keep it nice and organized and sterile. So again, wiping from anterior, front to back, and then anterior to posterior. You guys see that? Okay. Then once I have that, then go ahead and take my sterile gloves. And these are sterile gloves. These are obviously, we use these all the time. And again, they come just like this in this bag. So these are nice and sterile. And when you take them out, you hold this cuff right here. You guys see how this cuff is folded over? So this part around here is a place you can take your gloved hand and touch. Do we want to touch this and then try, because what are we doing? Now it's no longer sterile. We want to try to keep it as sterile as possible, right? Okay. So again, you can take your gloves and then put your fingers in there, and then if you need to, take your fingers here, shoot that out. Nice inside out gloves, this time to put it back correctly. Now with this, I have this ball of mess. I can take my fingers and adjust it like this. You guys see this? So I can do this because this is all sterile. So go ahead and put the glove so it fits nice and perfect. Okay. You guys seeing this? Good. Then once I have this, then I can go ahead and set up my sterile field. And then we set our sterile fields with these pads. And the very first thing, it should be is one big one like this and 2 little small ones. The big one goes underneath the mom's butt. Go ahead and raise your butt for me and slide on it just like that. Okay? Perfect. And then take the other sterile field. Take this. And there's a soft cotton part. This part is obviously going to go where? Yeah, on the skin. It's going to go on the skin. Okay. Go ahead and do like a V configuration. Everyone has different ways of setting up their sterile field, but this is how we show you guys. Go ahead, again, take this, and set up that V. Good. You guys see that? Any questions about that? Good? All right. Now what we're going to do is go ahead And I'm going to place my gloved hand, I'm going to take my left hand and place it on the perineum, which is what?
Oops.
What's the perineum?
Between the vagina and the anus.
Skin, yeah, between the vagina and the anus. So again, I'm going to put pressure on it, prevent it from tearing any more than it has. Putting pressure on the perineum. And then as the mother is feeling the urge to contract, and again, my other EMT partner is right beside her, coaching it through her. She's going to start pushing. And I have another hand on the head, guiding the head out. As it comes out, when I'm going to check, again, I'm not pulling, I'm just guiding the head out. Then I'm going to observe the neck. What am I looking for in the neck?
Cord.
Yeah, the cord is pretty much the same fancy word, cord around the neck. And that's obviously a problem, because we don't want to have a cord around the neck. What are we going to try to do? Yeah, wrap it, try to slip it over the shoulder if we need to, over the head. If we can't do it, it's like so tight that we can't move it around. What do we have to do?
Cut it.
Clamp and cut. Okay. But I'm going to say I don't observe no cord. At this point, if there's a change in your skill, it says, you have to suction. We're just going to verbalize, do I need a suction if there's any reason to suction? And my proctor will say, no, so I'll keep going. So for that part right there, you're just going to verbalize. You're not actually going to take your suctioning, which is this device right here, and actually suction unless your proctor says there's need to suction. Any questions about that? All right, so head's coming up.
What would be a why would you need suction?
If you see any fluids, any kind of yeah, meconium fluids, that's obstructing the airway, it aspirates it, and that's a problem. So that's why we have the need to suction.
You guys know what meconium is, right? So the baby's in distress if there's any reason, and if you see that, you do have to suction. They changed that in the skills, so our skills book don't reflect that yet, so it makes it a lot easier because a lot of people would always forget to suction either the first time or the second time. But just make sure you mention, do I need to suction?
Good. All right. So keep doing that. Now at this time, go ahead and I'm going to go ahead and guide the shoulders out. And if the baby's turned on the side right here, always guide the shoulders down and then guide the shoulders out. And we're doing that to miss the symphysis pubis right here, which when the baby comes out, its shoulder hits the symphysis pubis. And that's why we guide it down to miss it and then guide it back up. Okay? So I do that. Baby's coming out, baby comes out. Boom. Now at this point, this is the fun part. All right, are we going to raise this baby up high? No, right? We're going to keep the baby nice and low, ground level, okay? And we're going to have good, strong hold of the baby, right? Because what's covered in this baby's covered in all kinds of fluids, right? Makes it very slippery, so we're not going to just go like this and hang off to the side. Both hands supporting the body right there. All right. Then at this point, it says again to restate, do I need a suction? If your proctor did say you do need a suction, what do we suction first? Mouth. And this works by you push it in, and then as you retract, it's suctioning in. Okay. So for example, he says go ahead and suction. I'll suction the mouth first. Go ahead and retract. Squirt the fluid out on this side. Again, push in. Then suction each nostril. Do that. Put the fluids over there, suction the other nostril, put the fluids there. Okay? You guys see that? Perfect. Then I'll go ahead and keep that in my sterile field. Now at this time, we go ahead and wipe all that fluid off the newborn. Again, you just gently wiping down the baby. Okay? Wiping it down, wiping it down. And what are you doing by wiping it down? What else are you helping? You're helping stimulate the baby to breathe and everything and be active and everything like that. So go ahead and move it down because that baby was in a nice, warm, comfortable environment for 9 months, and all of a sudden it came into this whole new, cold environment. So we want to try to keep it warm. That's one of the main reasons we do this. So keep it nice and warm. The wet, soaky rag, we're going to go ahead and toss it on that side. Then we go ahead and wrap. On this, again, you can just, as long, what I don't want you guys to do is see this. Okay, it's wrapped. Right? What's the problem? I get the extremities in the head, right? So again, just take it. I want the whole body to be covered. Okay? Just go ahead, unfold the whole, just like that. go. Alright, once I do that, then what else can I do? Head, exactly. Comes with these nice little caps. This one's kind of old and stretched out. But go ahead and put the cap on. Keep it nice and warm. Good. Okay, once I have it wrapped and perfect, at this time we go ahead and assess for APGAR. I'm just going to go ahead and set it down so I can talk about APGAR. What's APGAR?